I can really recommend being a foster carer for Notts County Council. There's always someone walking the journey alongside you, whether that's other foster carers or social workers. It really helps to provide stability and consistency for children who really need it, and that's really rewarding as a foster carer.
Roger and I have been fostering for 35 years. We do deal with challenges, but to say we've been doing it for 35 years to me proves that it's not impossible. We learn an awful lot from these young people, and even now we're still learning.
As a foster family, we care, we want to make a difference, and we get so much fulfilment from fostering. The satisfaction of making a difference is something that money can't buy. Just seeing the smiles on the children's faces and helping them reach their potential is wonderful.
We work as family workers within the fostering service for Nottinghamshire County Council.
I really enjoy my work. I really enjoy meeting lots of different foster carers.
You know, we get to know the families, we get to know the kids, and we care, basically. It's important as it is to them that the kids are getting the support that they need.
A lot of people said to me they would like to be a foster carer, but there's something stopping them. I had that as well. And we decided just to jump in and do it and see what happened. And for us, it's been the best decision we've ever made.
It's been a fantastic decision, it really has, yes.
Once people start to become a foster carer and take that leap to do it, they'll understand how much it gives back, not just to the child, but how much it empowers you as well.
I'm Leon, I'm a care leaver, and I've been in care since I was 8. I've been with the same parents since, and they're amazing. Like, they are my foster parents, but I do class them as my parents, my mum and dad. All a child wants really from a family is to be supported, loved and cared for, and know they're there because they're wanted. From personal experience, I know the difference it's made for my life.
We always say that we foster as a whole family. It's not just us who are the carers, our children are involved in that. And even now, people express concern about the effect on our birth children of foster caring. I think we need to kind of get past that and dispel that myth, because actually the overall effect on our children, I think, is positive. They're learning new skills, they're gaining empathy, they're interacting with children from different backgrounds. For a long time we didn't make use of support care, and we wanted our child to settle into our placement and not feel pushed out, but it's actually been really helpful for us to start to have support care.
We've known Zoe for a number of years, and it's meant that we got to know her foster child. So for her it's been like coming for a sleepover rather than a feeling she's coming to another family. I got into fostering for Notts County Council, and it was something that I've always wanted to do, but working full time and my husband also working full time, we thought it's not really going to be something we can do now. But after looking at the website, we realised there was this wonderful thing called support care that we were able to offer. It might surprise you, but actually I'm under 30, I don't have any children of my own, and that doesn't stop you from being a foster carer.
I think some people don't go into foster care because they think it's going to be really costly to have another child living in their house, but actually the fostering allowance is generous enough to cover all the costs of having a child living with you.
We have a lot of fun on the weekends when we have foster children in. We get to go to parks, ice skating, children's events, trampoline in parks like I Jump.
We get access to the Max card, which is a discount card for foster carers and their children to access different local amenities. Also recently we went on holiday and we were able to use the Max card to get free access to some castles and historical places because it's a national initiative.
We chose to go with Notts County Council because of the support care that was offered and the training. And it's always local to Nottinghamshire. My parents are foster carers for an agency and they found it really difficult to get support care for their child.
My name's Lynn. I am now a support foster carer. We were mainstream carers, but given our ages, we felt that we couldn't commit to children for long term anymore. We just find it really rewarding, the relationships we build up with these young people, and we feel we're perhaps a bit like grandparents to them. With the children coming here for weekends, this enables their mainstream carers to have a break, and this makes things more secure perhaps for the children to continue there. I work with my supervising social worker to sort out the dates. She comes out to see us every month, and it's all very relaxed. I find Robin really easy to speak to. She listens to my concerns, and I value what she is saying to me in return.
The benefits of a supervising social worker are always having someone to contact. There is also emergency duty team that they can contact on a weekend and out of hours. I think the times that it gets difficult is when, you know, she's supported a child for a long time and then they're either moving on out of area or they're moving on because they've reached the age of 18, you know, and she has to say goodbye to that child, so that can be always emotionally draining. Generally, it's staying in touch so they know that you do care about them and you are concerned, you know, that the impact that something like that has had on them.
You do feel fully supported. It's like working in a team. We still even now go on training sessions. I almost look forward to those sessions because you meet other foster carers there and it's very interesting. I've always fostered with my husband, who's brilliant, and I feel personally I couldn't do it without him. He's super with the kids, and it's just something we continue to enjoy doing. A lot of our friends feel at the ages we are, we shouldn't be doing it, but it's a way of life for us now.
I'm Mark, I'm a foster carer dad in the family. I'm the fun dad, if you like. I've tried to be anyway, try to be.
And I'm Amy, a foster carer. So we have 4 children of our own and then we foster younger children into our family. Being a foster carer is a devastating privilege. It's devastating that children have to be in this situation, and yet what a privilege that we are able to help them.
Yeah.
When you foster as a family. I think it's very important that everybody in your house is involved. And even though we have 4 children of our own, we don't find that a challenge, we find that quite an easy thing to do. Daniel particularly, he's older and he sees more and he understands more because he's older, and he feels that it's given him an insight as to when he's older and he has his own children. Whenever a placement ends, we always ask them, do you want to do it again? Would you like another child? And it's always yes. And even though we've had the sadness maybe of a child leaving, and they are sad when a child leaves, the positive that we get out of it, they get to see, as we do, the happiness when a child leaves us, and that inspires them as well to want to do it again and again and again, as well as us.
When a child leaves, it's sad for us, but it's happy for them.
The biggest thing for us has been the support network, because if it wasn't for them, I don't think we would be able to carry on. I think it's a big, big thing to know that there's always someone there if you've ever got problems. And for our children, they really enjoy the events that we attend. We've been quite surprised at actually the amount of events there are.
Barbecues and picnics and
local supports
groups. And Foster's Got Talent. We've been to the Christmas do's and the Sons and Daughters events here today are fantastic for our children. They really enjoy it, and I think it's a lovely thing for them to do.
And it's very empowering for them to know that they're appreciated as a child in a foster family.
We are allocated to new foster carers so that we can give them support and advice before they get their new placement. So we might go out and give them some advice around therapeutic parenting and kind of build up their foster carer toolkit before they begin.
Yeah, and we've got an idea of obviously the child who's being placed with them, so that we can tell them some background about that particular child.
We find that children that have experienced trauma or have attachment needs are more responsive to therapeutic parenting than your average parenting. So that's very much what we encourage our foster carers to do.
Theraplay is obviously a form of therapeutic parenting. A lot of the foster children, their early life experiences of being quite sad, really. They haven't had any compliments. Nobody's ever said that they've got nice eyes. Nobody's said that the hair's nice. So that is something that we always start off to build their self-esteem.
Yeah, there's lots of nurturing activities, so tactile, skin to skin contact, eye contact. We'll offer nurture in positive ways, introduce it slowly, so we might do touch with a feather, maybe feather face painting.
One of the main purposes of therapy is for them to achieve, so we always want them to do really well. And we adapt the games depending on the age and the abilities of the children. When I go out and visit foster parents and explain what therapeutic parenting is, it's as if a light bulb just turns on in the head.
I think because we visit regularly, we go back and get the chance to go over what we talked about last week and see if they've tried it out and if it worked, and like you said, that you've had that light bulb, oh, I tried what you said and what, it worked.
I'm Gemma and this is my husband Paul, and we're both foster carers. I think initially we were a little bit anxious ourselves about going to panel. It sounded quite scary, but it wasn't at all. It was just a really friendly chit chat with a group of people around a table. It was more of a celebration really of us being there and of us, wanting to become foster carers. The County Council offer a fair rate of pay, so we get paid dependent on our level of experience. So after you've done it for a while, then your level of pay will go up based on your experience and level of training that you've done. We've also got a network hub, which is a foster carer support group, and it's just an informal get-together. We feel so valued as a foster carer for Nottinghamshire County Council. Everyone's so caring and wants what's best for you as a family. The matching process is really careful, so they listen to our needs and, they would never think of placing a child that wouldn't fit in our environment. As a foster family, we try and just make it everyday, normal life, try and bring some stability and love to that child that's staying with us and give them experiences that perhaps they've not experienced before. We love going out on day trips together, and for example today we've come pony trekking. Nottinghamshire's a great place to foster because we've got so much on our doorstep, there's so much that we can do. I feel really lucky that we're able to foster here.
I'm Leon, I'm a care leaver. I went into care when I was 8 for reasons of basically not being looked after properly. So I've been in care for 15 years, long time. I was very, very nervous to start with, very quiet. I used to be very, very withdrawn. My foster parents encouraged me to go to my friend's dance group. At first I was a bit and then so much clicked, and now it's a passion and I really can't imagine my life without it. I just live dance now. I started my degree and I've now completed a 3-year degree in contemporary dance practice. So I'm classed as a professional contemporary dancer. It's made me a different person, made me a better person, I think, and it's made me realise what I can do. Without my foster carers and the fostering service, they've made my life go a completely different way of what it would be if I wasn't in care. For my next plans I've got, which is hopefully moving to Beijing to teach English and teach dance and train over there and just travel, they're so supportive. When I told them about it, they said go for it. My parents said that there's always going to be a room if I need to come back for a little bit or if I come back to visit. I class them as my real parents because they've just, everything they've done for me. There's a lot of children out there who need a second chance at life or just need that extra support that if their parents can't give them. Anyone can do it, and if you feel like you want to but you're unsure, as far as I can say, I'd say give it a go, because from personal experience I know the difference it's made for my life.
This winter, more than ever, with COVID-19 still circulating, we need help to reduce all avoidable risks. You can help protect the NHS, social care and loved ones by getting the flu vaccine. You may be eligible for the free vaccine at your GP or local pharmacy if you are over 65, pregnant, or have a long-term condition. Find out if you are eligible at nhs.uk/staywell. Children up to Year 7 can get the free nasal spray at school or through their GP if they are below school age. If you are not eligible for the free vaccine, you can pay for it at your local pharmacy. The flu vaccination does not give you flu. It reduces the risk of catching flu as well as spreading it to others. If you had the vaccination in the past, that will not protect you as the flu strain changes every year, so you need to have a new one this year. It is also important to wash your hands often with warm water and soap. Use tissues when you cough or sneeze, and bin used tissues as quickly as possible. Thank you for helping to protect yourself and loved ones this winter.
COVID-19 is in our communities and the number of cases is on the rise. So it's essential that we each play our part in full by following all of the government guidance. Only by doing this can we keep our schools and businesses open. If you're young and healthy, you may feel the virus isn't a threat to you. But someone more vulnerable to coronavirus than you, perhaps someone closer to you than you realise, is depending on you to play your part in breaking the chain of transmission. So I'm asking everyone to do their bit. Stick to the rule of 6 for gatherings indoors or outdoors. Wash your hands thoroughly and regularly. Wear a face covering in enclosed spaces. Observe social distancing of 2 metres or 1 metre plus precautions where 2 metres really isn't possible. Follow all of the guidelines about car sharing. If you
Great, we've had the thumbs up. Welcome everybody to this morning's meeting of the Adult Social Care Public Health Committee, and welcome to anyone that's following it on YouTube. Item 1 on the agenda is the minutes of the last meeting on the 14th of September. Seems a long while ago now, but 14th of September. Everybody's had the minutes as a pre-read, so I'm making the assumption that everybody's read it. So can the minutes be agreed, please? Anyone against? Councillor Boyd-Elliott, please.
No, I'm not against. I was approving them.
Oh, you're approving. Councillor John Doddy, were you seconding? Yeah. Councillor Martin, please. Councillor Martin.
Yeah, thank you, Chair. Morning, all. At the last Adult Health and Social Care meeting, we were promised an updated report on the current adult social care performance and financial position to be circulated to committee members as soon as was practicable. This has not been done. It's not been produced despite a promise from the service director. I put it to the committee that last month you were really voting for a financial report in the service director's words that was not up to date and not an accurate picture of the financial position of this service. So why then has we not received an update in between, or we got to wait till December for one? In lieu of the actual report requested, can the service director please give a verbal update on the financial position of the department?
Yeah, thank you, Councillor Martin. The minutes, as you're well aware, are an accurate historical record of what took place. Therefore, it isn't, you're not querying what's in the minutes, you're querying that we didn't have a paper to back up one of the reports. So
Yeah,
I'll
no
ask the Corporate
no action
Director
was
for
followed
Adult
up, yeah.
Social Care, Melanie Brooks, please.
Yeah, my apologies. I thought an update was sent, and what we agreed to send was the update that was going to the finance subcommittee, which was later that week. So I will follow up afterwards as to why those papers weren't circulated. But it, like I explained at the session, it's about the timing, and the timing not just of Adult Social Care Committee, but Finance and Major Contracts Committee as well. It's the timing in the reporting cycle of the council.
Thank you, Councillor Martin.
Yeah, but my point here is, I don't want to be facetious, but the actual report that you gave to the committee was the complete contrast to the report in the paper.
Yeah, Councillor Martin, you're exactly right in what you're saying, and you do need to see that report. But can I remind yourself and other members that the Adult Social Care and Public Health Department are absolutely stretched at the minute. We do have to bear with them because everybody's on the front line, everybody's working every hour of the day. But as I say, you are right, we should see the report, and I'm sure Melanie will send it on to us when she gets a chance. So bearing in mind all of that, anyone against the minutes, please? Anyone abstaining? Councillor Martin, therefore, could you do the full register then, please, Keith, as we're not unanimous on this one, please?
Certainly, Chair. So I'm just going to read out the list of the members present. Just to underline, this isn't a recorded vote, so it doesn't go in the minutes unless two or more members request that. So I'm just going to read out names alphabetically, starting with Councillor Joyce Bosniak. Hello, Councillor Bosniak, can you hear?
4.
Thank you. And Councillor, I did, thank you, Councillor Bosniak.
Thank you.
And Councillor Dr. John Doddy.
Agree with the minutes.
Thank you. And Councillor Boyd Elliott.
4.
Councillor Sybil Fielding.
4.
And Councillor Tony Harbour.
4.
Councillor David Martin.
No, I'm not reading.
Councillor Martin. Against. I would just underline it. I've just checked, Councillor Martin, and it does capture the fact that an updated report was going to be circulated. So, but I'm happy to record it as a vote against. Councillor Purdue Horan.
4.
And Councillor Sissons.
4.
Councillor Vickers.
4.
Councillor Wise.
4.
And Councillor Woodhead.
4.
Thank you very much, Chair. So the minutes have been agreed, and that was 10 members voted for and 1 member voted against.
Thank you, Keith. We'll now move on to item 2 on the agenda, which is apologies for absence. Keith, could you give the apologies, please, and list members present and officers present for the benefit of anyone watching on YouTube, please?
Thank you, Chair. We actually haven't received any apologies for absence today, so I'll just underline the membership of the committee. So as well as yourself, Councillor Harbour, we also have present today Councillor Joyce Bosniak, Councillor Dr. John Doddy, Councillor Boyd Elliott, Councillor Sybil Fielding, Councillor David Martin, Councillor Francis Purdue Horan, Councillor Andy Sissons, Councillor Steve Vickers, Councillor Muriel Wise, and Councillor Yvonne Woodhead. And in terms of officers present today, as well as myself, Chair, we also have Melanie Brooks, the Corporate Director, Adult Social Care and Health, Sue Batty, who is the Service Director, Community Services, Ageing and Well, Gary Jones, who is the Interim Commissioning Lead, Ainsley McDonnell, who is the Service Director, Community Services, Living Well, Grace Natoli, who is the Director of Transformation, Natalie Burkett, who is Group Manager, William Brearley, Executive Officer, and Jenny Kennington, Senior Executive Officer. Thank you, Chair.
And
thank you,
Jonathan
Keith.
Gribbin is. I'm here at the moment as well, Keith.
Oh, sorry, Jonathan. Sorry, I had been giving you apologies, and I'd taken you out and put you back in when I saw you on the line. I do apologise.
Thank you.
Thank you. We'll now move on to item 3 on the agenda, which is declarations of interest. So do any members or officers present have any disclosable pecuniary interest to declare? And do any members or officers present have any private interest, pecuniary or non-pecuniary, to declare? Councillor Martin, is that a legacy hand? You're muted. Thank you. As I always say at this conjuncture, if anybody does realise later on in the meeting when we're on an agenda item or discussing something that you realise you do have a pecuniary or non-pecuniary interest, no problem, just shout up at the time and we'll record it and let Democratic Services know. So thank you for that. We'll now move on to item 4 on your agenda, which you'll find on pages 19 to 18 on your agenda pack. The title is Public Health Services Performance and Quality Report for contracts funded with Ring Fence Public Health Grant, 1st of January to 31st of March this year, so it's the first quarter of the year. So the report provides an overview of performance for public health, directly commissioned services and services funded either in whole or in part by the Public Health Grant from January to March this year. A summary of the key performance measures is set out on the first page of Appendix A, which is in your pack. This performance report shows that the majority of targets across public health services for quarter 4 were achieved. The recommendation of the report, as set out on page 15 of the agenda pack, is for committee to scrutinise the performance of services commissioned using the Public Health Grant. So to debate it, I'll formally move the recommendations. Do I have a seconder, please? That's Councillor Boyd-Elliott. Thank you. I'll now move over. I've got Will Brealey on the list. Jonathan, is it yourself now that's fronting this one?
For this report, it's Natalie Burkitt.
Natalie Burkitt, please.
Thank you, Chair, and good morning, committee. This quarter 4 report is probably the last fairly normal performance report for Public Health Commission services I'll be presenting for a while, as lockdown, as you'll be aware, came in on the 24th of March, and therefore, to all intents and purposes, performance in this quarter was not affected by COVID. So, as members will see, the only 2 services with issues were the 2 outgoing providers for smoking cessation and obesity prevention and weight management, albeit the latter only had one area in respect of children of lower performance. It's unfortunately the way, no matter how stringent performance management is, for a provider that has not won a tender exercise or who is being decommissioned to decline in performance. This has been especially the case for the payment by results service of smoking cessation. Basically, from the first week in January, the provider knew they would not be paid for any work as their payment was based on a 12-week quitter, which would only have been realised after their contract end date. What I can say, however, about both providers is that they engaged with the new successful bid of the Integrated Wellbeing Service really well, and there was a smooth transition of staff virtually to that provider. That's all I have to say in relation to the report, but I can see hands up already, so I'm very happy to take questions.
Thank you very much, Natalie. I've got Councillor David Martin, Councillor Joyce Bosniak, Councillor Andy Sissons, Muriel Wise and John Doddy. So first of all, Councillor David Martin, please. You're muted, David.
Yeah, thank you for that, Natalie. Obviously, I accept the delay in presenting this report to the committee, and things have changed dramatically. We are now discussing a woefully out-of-date report, really, which I'm afraid bears no resemblance to the current COVID situation. There are many things to welcome, however, not least the improvement in the engagement of alcohol and drug services. I know this is not entirely included in the report, but it would be useful to have a verbal update that can be given to the committee on what effect, obviously, lockdown has had on that, and what extra resources we're putting in to tackle the anticipated increase in drug and alcohol abuse after this report was written. You know, and another issue would be how many people have had the flu jabs. Many residents are having massive problems accessing doctors' surgeries as a result of the pandemic after this report was written. And I know I keep saying that, but it is a long time since the first quarter. There's been a particular problem in Hucknall where exponential development has coupled with the lack of investment in infrastructure, specifically to health services, which means that the services it's simply impossible for residents to access. I mean, we've got a surgery on Watnall Road with 12,500 patients on. With regard to the illicit tobacco products, when did we lose our dedicated police officer to disrupt the availability of these products, and what communications have we had with the Police and Crime Commissioner to replace that officer that deals with that specific area? And also, can you highlight to me again why the performance on smoking cessation in that quarter was so poor? Because it's evidently all the way through. With regards to domestic abuse, figures show that the reports of domestic abuse went through the roof nationally just after this report was written. 2/3 of women in abusive relationships have suffered more violence from their partners during the pandemic. 3/4 of victims also say that the lockdowns made it harder for them to escape their abusers. One call relating to domestic abuse was made to the police every 30 seconds in the first 7 weeks of lockdown. What impact do you think this will have on domestic abuse services in the next quarterly report? And what funding are we directing in that area to reduce and mitigate those circumstances? Because it's tragic.
Thank you, Councillor Martin. Can I remind you that this item states that it's regarding 1st of January to 31st of March, and I think you owe Natalie an apology for saying it's woefully out of date, because it's not woefully out of date. It is up to date for the first quarter of this year. Natalie, please.
I thank you for that, Chair. I do accept that usually members would have seen this report in July, but as the items on July's report were obviously very, very on COVID, this has been put back. Right, I've taken a few notes, and I do hope I'm going to answer most of your points, Councillor Martin. So you're quite right. Our substance misuse provider and our domestic abuse providers have been absolutely overwhelmed during the past 6 months. And in fact, we are setting aside some money in order to be able to help those providers, because obviously this overwhelming response of service users was completely unexpected. I cannot answer the question on how many people have had flu jabs, and I don't know whether any of my colleagues would be able to provide that response. You are, of course, absolutely right. Access to doctors' surgeries has been exceedingly difficult at this time, and that has affected our health check service. This was not deemed to be a particularly critical service, and as GPs were very much involved in the COVID response, that was actually put to one side. In respect of illicit tobacco services, unfortunately, we did lose our police officer. He is being replaced. There is a recruitment process out at the moment. However, what the police have said to our trading standards officers is that actually they're unable to go out and do raids on any premises that have potentially got illicit tobacco products. But what the officers are doing are preparing for Crown Court cases that they have already had in the pipeline. And they are, of course, still receiving intelligence and will be acting on that as soon as it is safe to do so. In respect of domestic abuse, I can provide a bit more information on this. Early on in the pandemic, it became exceedingly clear that the accommodation that the county had for women and children fleeing domestic abuse was a challenge. This was a national issue, not just particular to Nottinghamshire. And as a consequence of increased demand and reduced availability, The County Council were innovative and responsive to this need and established 20 units of short-term emergency accommodation with domestic abuse support attached. So these units were used by 13 women and 3 children from across the county throughout the summer. The accommodation has now closed because actually the accommodation was provided by the universities, and the women and children have been supported into alternative accommodation. The services were a particular success in accommodating small families and single women, which reduced the pressures, of course, on our district and borough councils. There is an evaluation of that service under development, which will explore the successes and challenges and considerations for the authority on this issue as we look towards the future. I hope that's answered the majority of your queries, Councillor Martin, but please do come back to me.
Yeah, thank you, Chair. I did say, whilst I accept the delay in presenting this report to the committee, I do accept the fact that COVID took over the other committees earlier this year, and we had a delay in the County Council's methodology for holding its meetings in May. Yeah, so thank you. It was no reflection upon your role as an officer. I just think, you know, we probably could have had the report by email. You know, if this happens again, and I think that was a very, very innovative use of the halls of the universities, you know, and I think you potentially could carry on using them at the moment. All right, thank you. Yeah.
Thank you, Councillor Martin. Councillor Sissons, Andy, please.
Oh, good, it was me.
So yeah, you go next then, Joyce. I'll put Andy next. Sorry. You
did read the names out, and I thought, well, okay. So first of all, I just want to say, Natalie, I know you've not been standing still, and I know that all that work you've been doing is carried on, and you've had more problems to deal with. But so I'm grateful for everything you've done. I think the next report that we see will be fascinating, because that will give us the kind of information that Councillor Martin's just spoken about, and I think that will be crucial for us. I've only got 2 little things to, I suppose, comment and have a little gripe about, and one is about GPs and the health checks. And within your report, it looks quite good that the health checks are improving, but what it doesn't tell us, and what we've asked for before, is which areas, where we know which GP surgeries, or you know which GP surgeries are carrying on with these health checks and which ones are still perhaps delivering a poor service. I'd like that information. And although this might be going to scrutiny, I think it's right for us to have that information, because, you know, we're the committee that should be having that. So that's one little thing. I'd like to know that a bit more detail. Is it still the usual suspects who are not meeting the targets? So I'd like that. And then secondly, just a little bit of a grumble about GPs, because not about the GPs, but we see adverts on TV all the time saying, don't forget your GP surgery is still open. You know, if you've got any conditions that you need checked for, go along. You can't do that because you can't get through on the telephone or anything. So it's not a criticism of the GP's practice. I think it's more of the fact that they're still actively promoting that people go to the GP surgery. And I've been trying for the last 2 weeks just to get in there and ask a question. So that's a little bit of a gripe, really. And then lastly, I'm mortified that the very people that need us most in terms of obesity is so woefully low, really. And I think once we get through this COVID crisis, we need to start really banging that home, because it's not about older people that we need. Yeah, we do need to work with older people who have got obesity problems. But unless we're tackling our young people as early as possible, then we're just storing up problems for the future anyway. So that's where I'd like to see some concentration of our efforts. But other than that, I accept your report, Natalie, and I think it's better than it's been in a long while. But I look forward to the next one. Thank you.
Thanks, Joyce. Natalie, please.
Yes, again, Joyce, you're very right. GPs are under pressure. To be honest with you, I'm sure Councillor Doddy will agree with me. GPs are under pressure even when there isn't COVID.
Yes.
they have a lot to do under their core contract, and sometimes some GP practices don't actually see health checks as maybe as important as they should. Definitely not as important as in public health would like them to think. And we do have officers going out to those GPs, or we did previously, to those GPs to offer them training, to ask them why they may not be providing services. And I know that I have previously promised to provide a breakdown, and I have put a note to myself that I will do that, and it will be, if it's okay with you, Chair, if I can do that via email to members, I will get that done. Yes, obesity is a big issue, and we know that people who are overweight may be more, may succumb to COVID more than probably somebody who isn't classed as obese. And therefore, it wasn't our decision. It was a national decision that during the lockdown period, weight management services were not deemed as critical. But actually, ABL, our new integrated wellbeing provider, did actually put some online exercise sessions on, and they also worked, obviously, as you're aware, the authority was sending out food parcels, and they would put recipe ideas, healthy recipe ideas, into those food boxes for people. So they didn't stand still on the weight management issue, even though it wasn't deemed to be a critical service. But it's just that we didn't monitor that during Q1. I hope that answers your questions, Councillor Bosniak.
Yeah, and I'm sure you agree that we should be targeting our younger people more. Thank you.
Thank you. Councillor Sissons, Andy, please.
Yeah, thank you, Chairman. Am I coming over loud and clear? Yeah, thank you.
Yeah, you're fine.
Very comprehensive report, and I found the appendix a bit hard reading. It's I could just about read it without a magnifying glass with my aging eyes. My question is, apart from paragraph 26, where mental well-being, the target of 60%, the performance was 83%, and I do appreciate all the work that's been going on. It's the only place mental well-being is actually mentioned. Everything else seems to have quite a comprehensive bit of reporting, but there's no mention of it in the appendix, and I just wondered if there was further information we should have had, or is it difficult at this time, Natalie?
Yes, you'll be pleased to know that there are a few less providers in this year, because we got rid of our smoking cessation and obesity prevention weight management providers into one service. So there may be a few more lines, so hopefully it might be a little bit easier to read. But what I would say about mental well-being is that actually that's the golden thread running through all of our services, and you know, it's something that we very much talk to our providers about in respect of our service users. And it may be that actually, because of your comment, Councillor Sissons, we look at possibly reporting on that in a better way, because I can honestly say that is something that we very much want to ensure with all of our service users accessing all of our services. And so I'll have to go away and think about that for future reporting.
Thank you.
Thank you, Mura. Thank you, Councillor Sissons. Councillor Wise, Muriel, please.
Oh, thank you. Thanks, Natalie, for the report and for your earlier briefing. Just 2 or 3 things. And I know in a way it's as much an issue for the clinical commissioning group, really. I agree with what's been said about GPs' difficulties during COVID. What concerns me is the kind of unevenness of GP provision. I mean, it applies to the health checks. I know the last time you mapped the provision of health checks in Gedling, where I have a district, was very patchy. Some practices were excellent, others were just not picking the issue up at all. And it seems to be the trend during COVID. You know, I happen to be linked to really good practice, so I've had good phone conversations. They've used photos where that's been appropriate. You know, my situations have been triaged really well. But I know that many other people have had a really poor service. And so it's the kind of unevenness of the service that people get. There should be I know there's bound to be some variation, but really there should be I think there should be a much better consistency about what GPs are offering, whether it's during the COVID period or, I know it's not an easy thing to tackle, but I think it just leads to, I think some of it does lead to health inequalities. Yes, just two specific comments. One about the domestic abuse services. Certainly the accommodation issue was a really positive contribution. My concern at the moment is I have few cases now all the time, not so much from direct abuse in one household, but the follow-on of that that affects contact and access arrangements. And in talking to the agencies, both our district teams, the CAMS service and CAFCAS are all kind of reducing what they can offer in terms of contact, and obviously things have been delayed going to court. And it does worry me that the resources of all those agencies are really stretched. So many children are in very fraught contact arrangements where one partner is still using abusive power to deny access to one or other of the children. I know there's no quick answer to that, but I think we just need to be aware that it's not just the period of abuse itself. It's about, particularly about support to the children, which seems to be very limited at the moment, both through CAMS and CAFCAS. Yeah, the other query was just about the oral health promotion. I see that from Catherine's briefing before that you're putting some additional funding into oral health from reserves. But I just wonder what's the problem about kind of ensuring better oral health in children? Is it the difficulty of delivering it, or is it lack of resources? Thank you.
Thank you, Muriel. Natalie, please.
So yes, there is some unevenness of GP provision, and hopefully, you know, the information I can provide will be able to provide some more insight into that. We are hoping that with the arrival of the primary care networks, that actually GPs can kind of share these services through the network. So if one GP practice is unable or does not have the capacity to be able to do health checks, they could possibly refer to a GP practice within the network. So there are various ways that we are trying to ensure that there is more coverage, for sure. Yeah. Again, in respect of the domestic abuse services, you're absolutely correct. I went to the AGM of our provider in the South, Juno, last Thursday evening, and you know, contact and access arrangements are very much used as a form of control by perpetrators, and therefore it's an ongoing of the abuse suffered. We are, I mean, if I can talk about the MARACs, the multi-agency discussion on individual cases, there has been, so they've been over capacity basically over the last few months. Each MARAC runs every 2 weeks, and there's capacity to hear about 100 cases a month across the county. There has been discussion between the partners, and they're hoping to have an additional date in November to try and bring the numbers down to a more manageable level.
Yeah.
And that's addressing the problem, obviously, just in the short term. However, in the long term, new forms and arrangements will hopefully be put in place, led by the MARAC steering group, to ensure that referrals are of the correct risk level, and to address possibly repeat referrals. So hopefully that again will improve the output of the MARACs. In respect of oral health promotion, at the moment, well, obviously during lockdown, the tooth fairy, as I like to call it, because she does dress up as a tooth fairy, was unable to go out to schools. However, that again doesn't mean that she hasn't stopped working. What she has been doing is doing a lot of online work. It does mean that actually getting products out, so the toothbrushes, toothpaste, has been difficult.
Right.
But she is again trying to address that. And obviously good oral health does reflect on health altogether. Having, you know, bad teeth from a youngster, not having that good dental hygiene can affect your health in later life. So it is an important service, you're absolutely right.
Okay, thank you.
Thank you, Vera. Thank you, Natalie.
Sorry, Chair. Natalie, could I, outside the meeting, could I just speak to you about the process for a case coming to MARAC? Not now, but would that be all right?
She's nodding. She's nodding.
Thank you.
Thanks, Muriel. Councillor Doddy, John, please.
Thank you, Councillor Harper. I think that I'm going to just start off with the health checks, just to chuck it in there. We last year, or earlier this year, invited the County Council to come out to the surgery because we had a very high level of success, and we invited them out to see what best practice looked like. A health check is an interesting one that if I write to, say, Natalie and say, please come in for an NHS health check, that is one method of communication. If I write to Natalie and say, I have made you an appointment at 2 p.m. tomorrow to come and see Dr. Doddy for an NHS health check, that is a different level of communication. If I then actually send them a reminder, and if on the day of the appointment I text her with an appointment to say, Natalie, please remember your NHS health check is today, there's a significantly greater likelihood that Natalie will turn up. And therefore, an awful lot of what happens is about the means of communication. As I say, we took that effort and brought Jill and Sharon from the office out to the surgery and showed them how we got over 80%, etc. when we were doing it. So health checks can be a success. Now, I started on health checks, so I'm just going to continue on that just for a little moment, because it says here in item 7 that 194 people were seen, and these were people who were likely to experience a heart attack or a stroke. The idea of the word likely conveys no risk whatsoever. You know, am I likely to fall off this chair? I don't know. Likely is not actually a term that I thought fitted in there. We need a specific measurement like Q risk, which is the 10-year likelihood of a heart attack or a stroke, to convey the very importance of the NHS health check. So I was just going to sort of pick that up on a word. Likely conveys no actual statistical significance at all, and it should be replaced by something more meaningful. I was going to say that if we had 194 people in those 3 months that could have had a heart attack or a stroke in the last 6 months where nothing's been happening. That means that there's probably 400 people, the collateral damage of COVID, who may well have had either a heart attack or a stroke while we've been concentrating entirely on COVID. And it's a message that I'd like to get across, that COVID is not the only disease out there, it's not the only killer. And I'm glad that we're going to be concentrating further in the morning on actually reusing existing resources within the Public Health Department to get back to concentrating on the things that are killing people every day. And item 7 actually highlights that beautifully. There was 194 that we saved in the last 6 months. There's been 400 that we haven't saved. But to go back to the beginning, I think that the first 3 months of this led us into lockdown. However well we were doing at lockdown will determine how well we come out of it, and therefore the stronger we went in, the stronger we're going to come out. This report is full of green. This report is full of an enormous amount of success, and therefore I think that will keep us in good stead. Because time is limited, people haven't got the opportunity to sort of concentrate on all our successes, and therefore the red jumps out at us, and it's only right that we should actually look at that and examine it. I would like to just stop and say that from a smoking cessation point of view, you gave us a list of all the statistics, but on the back of that page, you give us a beautiful list of the breakdown per region. And the top region for stopping smoking in pregnant women with 5 positive interventions was Ashfield. And before this, the region with the highest number of pregnant women smoking in the whole of Nottinghamshire was Ashfield, which means that we are finding the people, we are targeting the people, we are intervening appropriately in the people, and I think that was an absolute delight to see, and that extra breakdown was completely eye-opening. So I think that the green has been fantastic. There is the 2 reds, and I think that it's probably worth just mentioning the 2 reds, particularly smoking. The problem with smoking since lockdown, interestingly, is that Imperial Tobacco have declared that their income has increased significantly because there is none of the cheap imports coming in from abroad. Nobody's going on holidays. There are less of the illicit tobaccos, and people are actually buying more cigarettes. They're not spending money on holidays. They have more disposable income, and it's been declared that that has been spent on cigarette smoking. And one of the disappointing things for me, and we're going to have to concentrate on this over the next period of time, is that the sales of vaping dropped 30%. That's related to the fact that people are working from home. They don't have the working restrictions on smoking that they've had over the last number of years, which has enhanced the reduction of daytime smoking, etc. If you work from home and you want to have a cigarette, there isn't anybody there to stop you doing it. And therefore, we have an enormous challenge going forward on this, that we need to get back to stopping people smoking and increased vaping use. But the rest of this document is actually about that type of intervention, which I think is particularly important. So I think smoking in itself is a big area that we need to concentrate on going forward. I think I would like to just say that the Greens far outweigh the Reds. We've done fantastically well. We're going into the COVID with a great strength behind us, but the challenge when we come out on the other end will be enormous, and I think that we're all going to have to work together very hard in order to make that a success. And COVID is not the only illness. Throughout this meeting, we need to continually remind ourselves we do these interventions because they're there to help people every day. And I think that we must continue to do that and increase the resources available for the non-COVID illnesses which are killing people daily. But I think you're doing a fantastic job in public health, and thank you, Natalie.
Thank you, John, and as always, thank you for sharing your professional experience, which is very powerful, so thank you for that. Natalie, do you wish to comment on that?
Well, I wasn't going to say it actually, but I can honestly say that Councillor Doddy's practice is an exemplar of good practice, which we have shared with other GP practices. And thank you very much for your comments, Councillor Doddy. Yes, we did go in strong into this COVID pandemic, and I can honestly say that I have been overwhelmed by the response of our providers to COVID. Yes, Q1 report, I have already drafted it, and I don't want to completely steal my thunder from what I'm going to report next time. But if services haven't been allowed to provide services face to face, they have very much tried to put everything online. And as there's already reported, our substance misuse and domestic abuse providers have been overwhelmed, but have met that with a sound response. Our NHS providers, so our hospital trusts, had staff redeployed in order to actually face the pandemic face on, but they have been excellent throughout, and in fact our 0 to 19 healthy families provider still managed to meet their KPIs even during lockdown. So altogether we have had an exceptional response from our providers, and yes, I'll be reporting on that next month. But thank you again, Councillor Doddy, for your comments.
Thank you.
Thank you. Thank you, Natalie. Our last speaker on this subject is Councillor Purdue Horan. Francis, please.
Thank you, Mr. Chairman. Paragraph 54 on page 14 reminds us that some of the challenges that our professionals face includes violence, in this case homelessness with substance abuse and so forth. And I think it's appropriate that this committee records in the minutes its thanks and appreciation to all the staff and professional partners for what they are doing on behalf of Nottinghamshire County Council. And I would commend that Natalie conveys that sentiment to everyone involved, to just remind them that we do fully appreciate the hard work and challenges that they do face. Thank you.
Thank you, Councillor Purdue Horan. I've spoken to the clerk to the committee and he's including it in the minutes of the meeting. So thank you very much, and it was right to raise that. Thank you very much. That's the last speaker on this item. You've seen the recommendations. I'll now take it to the vote. Anyone against, please? Assent will be assumed and it's a unanimous vote, therefore no need for a count. Thank you very much. We'll now move on to item 5, which is investing uncommitted public health grant for a healthy in Nottinghamshire, and you'll find that on items 19 to 28 in your agenda pack. The purpose of this report is to bring forward proposals for the use of forecast uncommitted public health grant in services to sustain and improve outcomes for people in Nottinghamshire County. The ring-fenced allocation of public health grant is subject to national conditions specified by the Department of Health and Social Care. The conditions apply to the use of the grant, including any unused sums which accrue to reserves. Based on current planning assumptions and spending levels, officers forecast that approximately £6 million of uncommitted public health funding will accumulate by March 2024. Appendix 1 in your pack details an initial group of proposals to allocate this forecasted funding, which align with the strategic and corporate objectives outlined in the report. This report also seeks to address the ongoing short-term need to deploy public health officers on COVID-19 outbreak management. Committee approved a resource plan in September last year for expenditure of the local authority test and trace grant in relation to the mitigation and management of local outbreaks of COVID-19. However, it has since become apparent that the outbreak cell would benefit from additional project support resource. The recommendations of the report are set out on page 25 in your agenda pack, and they are to approve the proposed investment of forecasted uncommitted public health grant in services to sustain and improve outcomes for people in Nottinghamshire County. 2, to approve the establishment of fixed-term posts in the Public Health Division, as detailed in paragraph 44 in your pack. And 3, to approve media communications relating to the launch and promotion of these programmes of work. So to debate it, I'll formally move it. Could I have a seconder, please? Councillor Elliott, thank you very much. Jonathan Gribbin, please, to introduce the report.
Good morning, councillors. If I can make one or two further comments in introducing the report, then let me say one or two things about context. So the context for the proposals is, as Councillor Harper said, the availability of uncommitted public health grant. But just to clarify, as we set out in paragraph 24, that 6 million of uncommitted reserves is what we're forecasting will accumulate over the next several years. Those monies don't exist right now. That's not monies we've been sitting on. Also, further kind of context here, I suppose, is the desire to invest this over the long term, and to do that if we can in a way that avoids pressures on other corporate budgets as well as delivering excellent outcomes. And then thirdly, the ongoing short-term need to deploy some public health officers onto COVID-19 outbreak management. So the strategy and the thinking behind this is that we're, as a council, wanting to enable people to pursue what is important to them, and to enable people right across all of our communities to do that. It's important that we extend the lives in which people live in good health, and that we do that, we focus that in particular in areas where outcomes have been poorest in the past. And the strategy and alignment section of the document really underlines the importance not only of healthcare services in this and the provision of services, as important as they are, but also overriding that almost, the importance of creating healthy environments which create good health. And that's what we're really wanting to focus on in particular, not only the consumption of health and social care, as important as that is, but the creation of healthy environments. And so we also set out something of a reminder about how we focus some of our existing investment from the public health grant across a number of policy areas, including those which could be badged up as health in all policies. But then more particularly then, just to draw your attention then to the in paragraphs 26 and following, what it is that we're proposing to invest further in at the moment. And those are several initiatives going under the heading of creating healthy environments, ensuring everyone has best start in life, and also making sure that we also attend to services which address risk factors for poor health and improve health. In paragraph 28, just to underline to you, what we're proposing here are a series of investments which are really about the extension and continuity of existing programmes of work, which otherwise would be eroded or have to come to a halt. And several of these are commissioned from other departments and from other organisations. So it's not anticipated to add significantly to resourcing required from within the public health division itself. And you'll want to be assured of that, particularly in the short term, while so many of my team are focused on COVID outbreak management. So it's paragraphs 29 and following which set out the specific things that we're proposing to invest in, and also your yellow appendix also contains a summary of the amounts that we're proposing to invest and over what period of time. And I'll pause and hand back to you, Chair.
Thank you, Jonathan. Thank you very much for that. I've got two speakers at the moment, Councillor Martin and Councillor Sissons. So Councillor Martin, David, please.
Thank you, Chair. Morning, Jonathan. It's clear, Mr. Chairman, that the poverty has played a positive part in the coronavirus cases and deaths. They're intrinsically linked. Take, for example, the middle super output area, or Sutton Forest side and New Cross. It's one of the most deprived areas in the county, and it's been consistently amongst one of the top middle super output areas in the whole county. And this is due to the density of housing and growing propensity of housing with multiple occupancy, as this report suggests, alongside the general demographics. The same could be said in the poorest areas of my division as well. Yet I fear the high figures may well be the tip of the iceberg, with hundreds of residents not being able to access tests. When you add in the comprehensive failure of the test and trace system, our country is in a far worse situation than figures might actually suggest. So I'd like you to come back on that if you can, Jonathan. Can I also welcome the £500,000 bid from the government for survivors of domestic violence? And in order to target this extra funding appropriately, what communication have we had with the Nottinghamshire Police to identify the main areas that this is happening in across the county? Thank you.
Thank you, David. Jonathan, please.
Yeah, thank you for the observations you've made. NHS test and trace and investment in that isn't the focus of this particular proposal, but I can say that it's something that we're very focused on within the council. We are, for example, increasingly taking on locally within the authority responsibility for following up on some of the contact tracing, which the nationally commissioned arrangement where they've been unable to make contact with individuals, and that's something which I hope in the coming weeks and months I'll be able to report on in more detail. In the meantime, yeah, there are a series of well-publicised shortcomings in the nationally commissioned arrangements, and you'll want to be assured that through the channels we have in the Local Resilience Forum, into the Ministry of Housing, Communities and Local Government, and through Public Health England, I'm taking every opportunity to make sure that those problems are understood and addressed and fixed for people in Nottinghamshire. But I think that is an ongoing work. It's a work in progress for the NHS test and trace system, and I don't foresee that turning around in the very short term. In terms of domestic violence and the money's secured for that, yes, we remain in close contact, in particular with the Office of the Police and Crime Commissioner, with whom we jointly commission services for people fleeing domestic abuse, and through them with our local police.
That's it, Jonathan. Thank you.
Yeah, I hope unless I missed them.
That's all right. As Director of Public Health in Nottinghamshire, I know you frequently do have communication with Public Health England, and I do know that you're always fighting Nottinghamshire's corner. So thank you very much for all your work and effort that you've been doing over the last few months. Councillor Martin, any supplementary?
No, thank you, Chair. That answered my question. Thank you.
Yeah, thank you, Jonathan. That was a good, comprehensive answer. Councillor Sissons, Andy, please.
Yeah, thank you, Chairman. Jonathan, whilst I fully understand that the grant is ring-fenced for health outcomes, I'm going to ask a bit of a premature question about two more items on the agenda. Can any of this funding be directed towards the item 6 on the agenda, developing a day opportunity strategy? Because obviously the daycare centres do have an impact on health and well-being of the people who visit those or aren't able to visit them at the moment. And also, whilst I recognise that in paragraph 35 money is going to be allocated to suicide prevention. Item 7 on the agenda, sustainability and future development of the approved mental health practitioner. I wondered if any of this funding, which I know is over a period, it's not straight away necessarily, can any funding from public health go towards those two areas?
Thank you, Andy. Jonathan, please. So I think two parts to my answer. Firstly, in paragraph 37, we do mention there that there are several more proposals remain in development, because of course the proposals that I'm bringing to you today would account for just over £1 million of a forecasted £6 million that would accumulate over the next several years. So we're doing some more work on this, and would be pleased to give consideration to those options. If you were pressing me for a provisional view, though, it would be that neither of those initiatives, worthy as they are, would deliver the kind of public health outcomes that would be required to satisfy the tests in relation to the conditions on the grant.
Thank you, Jonathan.
Can I just come back just momentarily, Chairman? Yeah, I do appreciate what you mean by that, Jonathan. It's just obviously that every service area with with social care and public health, we're looking for money, every penny from every area, and I just wondered if any of the money from the public health grant could be diverted to those areas. Whilst I do understand it's ring fence, but thank you for your answer, Jonathan.
Thank you, Andy. Councillor Bosniak, Joyce, please.
Thanks a lot, Chair. I actually think that if Jonathan has said yes to Andy's request, what we'd have next we'd have requests for potholes filling in as well, because everybody can make a case that public health money can be spent everywhere, where in actual fact it just can't. So I do understand that. Now, there's just two things I want to pick on here, and I don't have a problem with how you intend to spend this at all. I can see the logic and understand that. But one of my questions is around on page 20, where we talk about the development of the Nottinghamshire air quality framework. Now, my comment around that is so much of that is out of the control of the county council. And that concerns me because, of course, one of the biggest problems that we have is around traffic and congestion. And they're planning considerations rather than county council issues. So I want to know how you're trying to deal with that in terms of how do we ensure that our partners who make those decisions are fully aware of the need to protect the environment. So that's one thing. And in a similar vein, that around housing, and it's good to see that we are going to spend some money in that area. But once more, housing is technically outside of the control of the county council, because it is a planning issue. Refurbishing homes is a planning matter if they're council properties. So things along the lines of planning, I think, is a major issue for us if we want to either tackle health inequalities, for the reason that has just been said about the kind of properties that are being built, where they're all being built in a particular area, and sometimes I think it's like we're putting people with less money in specific areas and not spreading it around, and also the road situation. So our relationship with partners in this particular instance is so crucial if we are going to tackle those big things around inequalities and air pollution, to name just two.
Thank you, Joyce. Jonathan, please.
Yes, Councillor, I agree. It is challenging on an agenda like air quality or indeed housing, where which absolutely rests on a partnership approach, and as you know from chairing the Health and Wellbeing Board, there's quite a bit of that actually needs to be progressed through the Health and Wellbeing Board and through the Healthy Environment, Healthy Place sort of strand of work relating to the Health and Wellbeing Board, and it's largely through that we pursue the agenda and on air quality. but also linking up closely with our counterparts in the city, because of course it's an agenda which affects the whole of Nottinghamshire, not just the county. That's probably as much as I can cover on that for now, but please to come back and focus on air quality at another time if that was needed.
Thank you. Joyce? You're muted, Joyce.
I'm best muted. Just
no
come
comment.
back on that, and that is about the fact that there's this relaxation as well. Nationally, there's a relaxation on where houses can be built and the number of houses that can be built. And I wonder whether we're having any input into that conversation, because again, it will affect air quality and all the things that I've just said.
Thank you. Jonathan?
So what I think you framed as a relaxation there, I think you're referring to the change in the regulations and process around planning, and I will need to check with the corporate director for Place about whether we as an authority have made any kind of representations around that specifically. It's not something which I've given direct input to myself as Director of Public Health.
Thank you, Jonathan. If you would reply to Councillor Bosniak on email and copy committee members in, that would be brilliant, please. Thank you. Councillor Doddy, John, please.
Just unmuting there. Yeah, thanks very much indeed. Quite a simple question, but I'll just follow up on Councillor Bosniak's point that she was instrumental in the health in spatial planning protocol back in 2016 or whatever, and it's still a live document. And a document which allows the integrated care service to be involved in all planning decisions with regards to the earliest possible planning opportunity to look at the health implications, which again fits in with Councillor Martin's previous point about the lack of NHS services in places like Hucknall due to the development and failure to provide those services in anticipation. But we have got a protocol. It is there. I recently shared it with our primary care network with regards to the development of nursing homes and residential homes without proper concern being given to the requirements and the developments of the medical services to keep pace. So I think it does exist. We just need to sort of bring it back to life, so to speak. And it's always been a protocol by agreement rather than a statutory obligation. So sometimes it tends to slip through the net. I've just got a very simple question for you, Jonathan. It's around the flu vaccine campaign. It's just in the yellow pages 28. There is obviously a big push here to get people vaccinated, and every year as a winter precautions we bring the Queen's Medical Centre, Kingsmill Hospital, all the hospitals in and tell us how many staff have you vaccinated, etc. And we like to try and get up to 70–80%. The one thing that tends to lag behind is clinical, non-clinical staff, which are the backroom staff. If an army marches on its belly, hospitals are kept going and social services are kept going by the backroom staff who are actually doing all the work. And I just wanted to see a little bit of focus there that says that it's important to provide flu vaccines for as many as possible. If we're going to try and keep our workforce in work this winter, particularly at COVID times, this sort of focuses 75% of frontline staff, but it also talks about reduced level of sickness absence. And sickness absence is just as important in the people taking the calls as the people going out to respond to the calls. So for employing somebody, we need to encourage that, get the figures up from the 30-odd% up closer to the 60–70%, because we're all one unit, and never was it more important that we're all protected as much as anybody else, and not least so as we can separate COVID infection this winter from actual flu infection. And if we've got the money and we're ploughing it into flu, let's look at everybody. Thanks, Jonathan.
Thank you, John. Jonathan, please.
Thank you, Councillor. Yes, we've committed additional funds this year to promoting flu vaccination right across our population. We want to make sure that people who are eligible for free vaccination all take that up. because that's absolutely critical for them as individuals, as well as for us as a system. We also want our own frontline staff to take up the offer of a flu vaccination. That is not without problem at the moment, because very properly the vaccinations available right now are being prioritised for people who are eligible for a free vaccination. That's a very proper way to phase it, but it may mean there's a slight delay in some of our frontline staff getting it. But you're right to point out that people right across the population, whether they're frontline health and social care workers or in some other employment, or actually flu vaccination is, it's the single most effective way that any of us can prevent spread of flu. So it's something that we're wanting to encourage everybody to take up, and that's one of the reasons for wanting, particularly at this time, to bring a bit more resource to bear on flu vaccination.
Thank you, Jonathan. At policy last week, I raised this and asked them to put it on the front page of our website and the new MyNots app. And also, of course, we've now got the pneumonia jab as well that's doing the rounds, which is important, particularly if anyone catches COVID-19. So thank you for that, John. That was the last speaker. So we'll now take it to the vote. Anyone against the recommendations? Anyone abstaining? Therefore, assent will be assumed. Thank you very much. We'll now move on to item 6 on the agenda, which is living the lives we want to live, developing a day opportunity strategy for Nottinghamshire. And you'll find it on pages 29 to 42 on your agenda pack. So this report proposes a vision for the way in which adult social care will support and enable people to live the lives they want, and sets out how a day opportunity strategy will be co-produced. The strategy is intended to remove barriers and ensure more accessible day opportunities are available for people within the community. The COVID-19 pandemic has affected the way in which day opportunities are provided due to social distancing guidelines, ensuring that a COVID-secure interim offer is available for service users and their carers, and this will form the early stages of the work. The recommendations of the report are set out on page 38 and 39 of the agenda pack, and they are that the committee 1 approves the plan to further develop an interim day service model to support people during the continued period of social distancing guidelines. 2, approves the co-production approach the department proposes to take to develop a day opportunities strategy. 3, considers whether there are any further actions it requires arising from the information in the report on the development of the day opportunities strategy. And 4, agrees to receive a report on the draft day opportunities strategy in March 2021, and that this be included in the work programme. So to debate it, I'll formally move the recommendations. Do I have a seconder, please? Councillor Elliott, thank you very much. Corporate Director of Adult Social Care and Health, Melanie Brooks, could you please introduce the report?
Thank you, Chair. So committee, I'm going to handle this in 2 parts, if I may. So that this report does 2 things. It talks about the planned work that we had to rethink the way that we support people to enjoy a good life in the longer term through co-production, but it also flags the need that we need to do some urgent work to reshape the way that we're supporting people now as a result of COVID. So I'll start with the former piece of work. So committee set out on a journey of co-production, and you'll be hearing a report in next committee about how we're progressing with that. But many of you took part in the workshop we had pre-COVID, when we could actually sit in a room together to set out an intention that whenever we were shaping services into the future, we would do so by talking with people. So what we've set out here in the timetable on page 9 is a process of co-production where we want to work with people in Nottinghamshire to reshape their day opportunities. Just to say a few things about what that means. So day opportunities are the things that people, they're opportunities they can have in life to enjoy a good life. So for many people with a disability receiving care and support services, there's lots of barriers to doing so. So things that I might do, make friends, take part in sporting life, have a job, have some support, stay up late even, go out for dinner with a friend. There's many barriers to people with a disability being able to do that. Some are structural, about having access to changing facilities. Some are more around the way that we do things. So for many people, support is only available in the daytime in certain hours, for example, or staff finish shifts in the evening, which restricts the way that they enjoy a good life. So what we want to do is to go through a process of talking to people about the sorts of support that we have in Nottinghamshire that enables to do the sorts of things they want to do. At the moment, many of our resources in adult social care are tied up in our day services, and we talk through in the paper about where the money goes at the moment, so where that budget is spent, and then the sorts of people that currently use services and how much that costs. So that's on pages 4 and 5. So what we'd like to see in the longer term is more of a spread of where the money goes. So there's more evenness in terms of who we would support access, community life. We'd want to see many more employment opportunities and investment made in work readiness of people who have an ambition to work. And we'd also want some flexibility to be able to have what we describe as user-led or peer-led opportunities, such as the Stay Up Late campaign, the Gig Buddies scheme. There's a whole range of things that other authorities do that enable people to have flexible lives. Whereas, like I said, at the moment, we have very much our investment is in our day services. But it's really important that we do this with people. That includes the people that support them, such as carers and family members, as much as people themselves. So we set out a timetable for how we would produce a strategy. So the intention would be to be talking to people through the coming months and come back in the new year with the outcome of that conversation, which would be our strategy for day opportunities. So to sort of park that for one moment and talk about some of the issues that we're facing in day services. So day services is much narrower definition. So day opportunities is broad. That's about the way that you enjoy a life. Whereas day services, I'm talking specifically about those services that are open generally 10 till 3 that will support people through the day, many people, and that support around 1,600 people in Nottinghamshire. COVID has had a huge impact on this service in a number of ways. So first of all, it makes the services that run within Ainsley's department very difficult to operate because of the restrictions on safe working. And I think particularly with some of the impact about people being clinically vulnerable, more vulnerable to COVID, there's a whole range of risk factors that we have to balance. There are many people choosing not to meet other people at the moment, so making the choice to isolate who they speak to and who they mix with, and so the need to provide one-to-one support to people in their communities and homes has grown. I think we've been really successful at redeploying staff temporarily from our day services to a one-to-one model, but clearly now we're going to be living under these conditions for at least 6 months, if not more. So I think the government has been really clear in its announcements that we should be planning on living on these restrictions for a minimum of 6 months. So clearly the model of day service that we have is no longer fit for purpose in its current form. So we need to do some urgent work with people. That includes people that work in our services as well as those that use them and the carers, to rethink how we're going to support people into the short to medium term. So we're expecting that would have some outcomes to the way that we're delivering services. At this time, I'm unclear as to what that might mean for service contracts for some of the organisations that have a contract with us, for the cost, what that would look like. We need to do the work first, but it's just flagging that we need to do that, and we need to do that at pace. So I'm just open to any questions, please.
Thank you, Melanie. I've got 3 speakers at the moment, Councillors Martin, Wise and Bosniak. So Councillor Martin David, please.
Yeah, thank you for that, Melanie. It was a very inclusive report and it's answered a couple of my questions, actually. So with the new lockdown restrictions due to be announced today, tomorrow, one day this week, Nottingham spaces being placed on a local risk level 2. So this will again reduce the amount of social contact between households. How do you feel the anticipated measures will affect elderly and vulnerable residents who live on their own? And day opportunities are currently benefit 1,931 residents in the county. So, however, according to recent claims, the County Council identified hundreds of other vulnerable residents during the coronavirus lockdown, the boroughs and district councils did the same. Has any work been undertaken to amalgamate those lists where boroughs and districts have got other people they feel are you know, ought to be made aware of the opportunities available? And as regards the day services and the change in the day services, what anticipated changes do you think can be made? Are we going to get more technologically friendly like we are now with the residents that access those services?
Yeah. So a number of questions there. I'll start with the last one. So we have, as a department, commissioned some urgent work to look at digital inclusion, we're calling it, Councillor Martin. So we know that people, either because of their income, because of their living circumstances, it may be because they live in a residential home or a supported accommodation, all sorts of reasons, would lack a device, connectivity, or the ability to use a device. But yet we're moving to a world now where that is the main way of accessing support. So we've commissioned some urgent work to do that, but also has NHS Digital. So there's a piece of work that's happening right now where care homes can apply for iPad devices for care home residents to support with contact with family members. So we are taking some steps to do that in terms of technology. I think there's a lot to do, though, isn't there, to enable really quality conversation. I know, for personally, I don't like it at all working this way. I miss meeting with people. You can't really get away from that face-to-face contact. But I think there's a real tension between enabling somebody to stay at risk because of their health condition or disability that puts them more at risk of COVID and having appropriate social contact. And that's the risk we're grappling with day to day. So I'll answer another question about the impact on people. So we do support people in our buildings, as do many of our partners, and those that we commission and those that we don't directly commission, so the voluntary sector there. But there is that constant balancing of the risk. But there is a number of networks that we are a part of that are trying to bring those organisations together to try and discuss and share good practice. There's also the work of the Humanitarian Assistance Group. So Ainsley McDonnell is the ASH representative on that group, but it's chaired by Adrian Smith, and that brings together all of the district and borough councils, the county council, communities teams, and a whole range of voluntary sector partners to be doing that very thing about how can we share resources to make sure people are supported through COVID. But I think day services has a particular role in that, but you're right, it is much broader. And in terms of the risk, I think I am particularly concerned about the risk to vulnerable people, which is why we need to do the adult social care little slither of that, about assessing some of that risk and rethinking how we support people, because most people will be saying that COVID's affected their mental health. Most of us can relate to that. It's very difficult not being able to rely on the people we'd normally rely on. So there is some work that we need to do to be rethinking that. But there is also that broader work through the HAG, particularly about older people. I think you're right there.
If I can just come back to that, in the past where I've had committees of people who are generally older than myself, in their 70s, 60 plus really, who a few years ago where technology was alien to them. What we tried to do was we tried to encourage them to have tech buddies. Tech buddies can be a member of the family or a social worker or somebody in the hospital or somebody where they are ensconced at the time to help them with the technology. And I found that worked quite well, actually, because members of the family were quite happy to help their grandparents and assist them, or parents even, and assist them in the use of technology, because for some people it's quite a frightening and daunting prospect, especially people with mental health and there's a range of issues that could be helped with tech buddies, and it worked quite well. I'll just give you a typical example. I chair a Cromford Canal Society, and all of the trustees are over 70, all of them, and I got them all on Zoom this year. So I think there's a way forward for you, and it's a very complex issue. I think that's going to help other people. I had a resident yesterday whose wife is in a hospital. She's had a severe stroke, and he can't go and see her. And getting the technology to that lady in that ward and having a conversation over technology like this is quite a difficult thing for him to do. So I wish you well in that one.
Yeah, well, I wouldn't just sort of single out older people as having an issue with technology, because I think the research would show that there is an age relationship, just because of when it was introduced, but there's also a relationship with people's fear about being on video, a fear of talking to someone they don't know for the first time, like remotely, someone with cognitive issues, and that can be all age, people with mental health anxiety. So I think if we just overly focus on age as being a barrier, and I'm very mindful of the audience, so I think you know, age is not the only barrier at all. There's some very tax savvy older people. The digital inclusion work really needs to be all age, and if you think about the reading age of the different areas in the county, and the distinction we have from somewhere like Rushcliffe to some other parts of Mansfield, because that is a huge barrier, is someone's level of education and reading age to be able to engage in remote activity. So we have to be quite focused on some of the specific issues, I think.
Thank you. Councillor Wise, Muriel, please.
Thank you, Chair. Thank you very much, Melanie, for the report and the work you and Ainsley and the team have done on it. It's really inspirational. Even the title, Living the Lives You Want to Live, is a really kind of energetic and inclusive kind of title. And the plan for it not just to be consulted on, but to be developed through proper co-production, which is more time consuming, takes longer, but it's obviously much more effective if people are well involved. And I think the fact that it's a two-stage plan, one to kind of respond in the short term to the impact of COVID, but also to have a longer term plan for sort of the day life opportunities for people, not just whether they go to a day centre or not, I think is really good. I think the major problem for me, and which probably is going to lead me to abstain on this, is that the financial context of it is really difficult to grasp. I think in the past the discussions about the budget have started cross-party, so we've had a sense of what the budget challenges are going to be. At this point in time, certainly on our side, we don't have much sense of that, and obviously the financial implications. I know you mentioned the amount of money that's being spent at the moment, but the longer term financial implications within the whole council budget is obviously more difficult to identify. So that really needs to be part of a further discussion, as is obvious. I think also on a practical level, it would be useful, and I know you're not just talking about buildings now, but I think it'd be very useful to have the existing day centres mapped out for us so we can see where the buildings are and which are now accessible and which are being effectively used. But yeah, broadly, I'm very encouraged by it, but concerned about the finances.
Thank you, Muriel. Mel, do you wish to come back on that one?
Yes, I'm not sure if I can help. I mean, obviously paragraph 41 says what we're currently spending, and this report isn't proposing any change at this time to what we're currently spending, and describes a number of activities about developing the options mapping. Certainly that bit about mapping what we've got, what we're spending each bit, I think will be part of that activity, but that's certainly a really helpful suggestion and be something that I'd want the stakeholders through the co-production to have a good sight on and where geographically things are based.
Okay, thank you.
Thank you. Councillor Bosniak, Joyce, please.
Well, I've only got two issues really. I think the first one is primarily about the timing of this, because Melanie just said that we're going out speaking to people over the next few months. That will be extremely difficult to get people to come even think about it, let alone access the people and ask what it is that they need. So I've got an issue with that. And the other one, I think this is about buildings, because it's not just a building, it's about potential use of all buildings that we've got. Knowing where they are geographically, I think, is important, because I want to know that everybody, regardless of where you are in Nottinghamshire, you have equal access to a centre. And I actually like the idea of a day centre being so much more than a day centre that we have now as well. So I find the idea of altering how we do things very exciting. It's just that I don't really have a feel for what we're trying to do, because the day centres could be so much more than 10 till 3, could be used by the general community, could be used by voluntary groups. So therefore, improving the offer that we make to people when we know what people actually want. I think it's also to do with accessibility. So wherever they are across the county, are they in areas that are easily accessible by public transport? Or are we going to look at putting in a day centre, or keeping a day centre somewhere where it's not easy to get to? I just think there's a lot of issues there that I'm still not clear about. So on those particular terms, that's why I am going to abstain. And I'm not sure whether other Labour colleagues feel the same. But I think the idea is a good one. I just don't fully understand exactly what we're trying to do. And I'm loath to get rid of a building, close a building, because once it's gone, it's gone. So I need to have more of a sense. It's not
proposing any. Sorry.
It's not a dissimilar argument that we had when we were looking at children's centres. So it's about use, it's about potential closure, it's about accessibility. And I just think you're doing it in an extremely difficult time.
Thank you, Joyce. Mel, please.
Yeah, this paper isn't proposing any closure to any building or reconfiguring anything through what we're proposing is a piece of co-production to bring some work back to committee in March that's setting out what that would look like. So I recognise that co-production's a bit new, but and we've been talking about it as a committee for a while. But the idea is that work to answer all of those questions. Is it about transport? Is it about access? What does transport mean if I'm in Bassett compared to what would that mean if I was in Rushcliffe? All of those really good questions would be answered through that process. And so what we're asking for is to say we'll be bringing that back to committee in March in terms of the longer term piece of work. The shorter term piece of work, like I said, it's that shift about understanding how we support people at home in the short term, because we cannot access buildings in the same way because of the COVID restrictions. But again, with that piece of work at this time in this paper, we're not proposing a building closure. That's not what this paper is aiming to do.
Joyce, would you like to come back on that one, please?
Yeah, and I understand that, and I also understand co-production. I know it's not new and been talking about it for a long time, so I don't disagree with that. And although it doesn't specifically talk about the potential closures of buildings in this report, that could very well be a consequence of what we're doing. So I'd like to have an overall sense of what we've currently got, and then that would make more sense to me. I also think it's going to be problematic asking people what it is that they want for not a day service, but for activities throughout the day and evening at a time when we're going through COVID and potentially facing, if not a level 2, a level it could be a level 3, not just a level 2 across Nottinghamshire. I just think the timing's wrong, Melanie, that's all. I don't think the idea is wrong, I think the timing is wrong.
Would you like to hear from Ainsley? Sorry, there's loads of echo. If somebody could.
Sorry, Mel. Sorry, Mel. Can I just put in? Could everybody mute, please? We seem to have some interference on the line. Just checking who's not muted. Yeah, everybody's now muted. Yeah. Okay, Mel.
So Ainsley is currently leading some work about reviewing all of the people that receive day services to try and understand how we can support them better. So would you like to hear from Ainsley now about how we'll be undertaking some of that work to understand that? Would that give you some assurance about how we're doing that in a COVID safe way? Because Ainsley's ready to chip in. Would that be useful to committee?
Yeah, I've heard it before. Some of us have heard it already, but I do think it would be useful for the entire committee to hear about it.
Yeah, please, Mel. Hey, Ainsley, could you chip in, please?
Yep. So, as you can imagine, delivery of our day service has been quite difficult over the COVID period. We've gone from March, when we had to very quickly close the access to our buildings and come up with a model that supported people from their homes, whether that was in person or virtually. And then as restrictions eased, we have opened access to the buildings back up again, but that is on a very limited basis because obviously we need to adhere to social distancing and infection control measures, which does mean that our building capacity is limited. We have brought people back. We have looked to prioritise people who are at home with family carers, because although, you know, lots of carers coped in the beginning, but as this has become a more long-running situation, the cracks have started to appear, and carers very much need that support. However, there is still quite a lot of anxiety about coming into our buildings, about the potential risk of, you know, coming into contact with other people, and we do still have quite a lot of people who don't want to return because of those risks. So, and you know, as you quite rightly say, we've got a further announcement today, which we don't yet know the implications of that announcement, and we may need to, you know, again change our model of delivery. So this is such a fast-moving piece of work, and we're engaging with all of our usual service users. You know, that we're telephoning them regularly. We're still seeing many of them, and as I say, we have started to bring people back in. But there is a need to actually look at, you know, if this is going to be the situation for the next 6 months or even the next 12 months, how do we support people over that period of time? Because it has been till now fairly reactive, depending on how the situation has unfolded. So at the moment, we've got an awful lot of staff out, you know, talking to people, undertaking reviews of people's day service activity, and asking them, you know, what is it you want for now? Because as I say, you know, there's a lot of anxiety. Not everybody wants to come into a building-based service, so we need to be clear about how we're going to support them on an ongoing basis, whether that's you know, face-to-face contact, virtual contact. So we're going through that process now. It's a huge number of reviews to carry out, but you know, we are well underway. And that will help to inform how we then deliver day services in the short to medium term. And then, you know, following on from that and getting into this longer term strategic bit of work, that will then determine what our day services need to look like to fit in with that wider day opportunity strategy.
Thank you, Ainsley. That is the last of the speakers, but if I can just go over the recommendations just so everybody's clear on what we're voting for. So number one is that we approve the plan to further develop an interim day service model to support people during the continued period of social distancing guidelines. So that relates just to the COVID-19 era. 2, approve the co-production approach the department proposes to take to develop a day opportunity strategy. So that's just approving the co-production approach to look at the strategy. 3, whether there are any further actions it requires arising from information in the report on the development of it. And 4, agrees to receive a report on the draft day opportunity strategy in March 2021. Nothing we vote on today, correct me if I'm wrong, Melanie, nothing we vote on today will close any day centres. Although Ainsley referred to it as fast moving, yes, the work is fast moving, but no decisions are being made quickly on it, only the ones in relation to the COVID-19. So they are the recommendations that have been moved and seconded. Anyone against them, please? Anyone abstaining? Yeah. Keith, would you take the roll, please? As it's not unanimous, I'll ask Keith to take the roll. Again, as Keith explained earlier, this isn't a recorded vote. It's just recording the way people are voting, as daft as that sounds.
Thank you, Chairman. So I'll just start with Councillor Bosniak, please.
Abstain.
Thank you. And Councillor Doddy.
For.
Thank you. Councillor Elliott.
For.
Councillor Fielding.
Abstain.
And Councillor Harper.
For.
Councillor Martin.
For.
Councillor Purdue-Horan.
For.
Councillor Sissons.
For.
Councillor Vickers.
For.
Councillor Wise.
Abstain.
And Councillor Woodhead.
Abstain.
Thank you, Chair. That is carried by 7 votes for, and we had 4 abstentions.
Thank you, Keith, and can I thank everyone for your input on that debate. It was a really good debate and it's good to hear everyone's views, so thank you very much for that. We'll now move on to item 7, which is the sustainability and future development of the approved mental health practitioner, and you'll probably hear it as AMHP service. So the Council has a statutory duty to carry out assessments under the Mental Health Act 1983, which was revised in 2007. Current service provision is compromised of the county-wide approved mental health practitioner team providing a service during office hours and the emergency duty team. That's what you'll hear quite often referred to as EDT, which covers all other periods out of hours, including weekends and bank holidays. Demand on mental health services has risen year on year, and the impact of the coronavirus pandemic on mental health and well-being has seen demand and acuity increase further, placing considerable pressure on the approved Mental Health Act practitioner services. In order to address the additional pressures on service, there is an urgent need to address service capacity and explore alternative models of delivery in order to ensure that we can provide an effective response to people experiencing a mental health crisis and protect employee well-being. The report seeks committee approval to increase capacity and improve the sustainability of the approved mental health practitioner service through investment in additional staffing capacity and development of an alternative model of service delivery. The recommendations of the report are set out on page 48 of your agenda pack, and they are: number 1, the establishment of a 2.8 full-time equivalent approved mental health practitioner, which is Band C, on a permanent basis, plus additional associated costs to support a 24/7 service model. And 2, the development of an alternative model of service delivery that moves toward a 24/7 service. So to debate this issue, I'll formally move it. Do I have a seconder, please?
Welcome report, more than happy to second
Councillor,
it.
sorry, Councillor Purdue-Horan beat you on that one, Boyd. Thank you.
All right.
Ainsley MacDonald, could you please introduce the report?
Yes, thank you, Chair. So in order to deliver our duties under the Mental Health Act, it's imperative that we have a robust and sustainable approved mental health practitioner service in place. And I will likely refer to that service as the AMP service. That's what it's commonly known as. For those of you that may not be familiar, the AMP practitioners mostly deal with people when they're in acute mental health crisis, so at the point when potentially someone may need to be sectioned under the Mental Health Act. However, they do have a broader remit than that. They do undertake an awful lot of our partnership work with Mental Health Trust, as well as ongoing case management of people with, ongoing mental health needs, and making sure that, we do have good standards of AMP practice across the county. So the current service is under immense pressure. It has been for quite some time, but the impact of COVID has really driven that home. And our demand continues to increase, both in terms of volume, but also in terms of acuity. We're seeing people who are much more unwell. The arrangement of services at the moment doesn't just sit within adult social care. The county-wide AMP team in adult social care provide the AMP service Monday to Friday during office hours. That's then picked up by the emergency duty team out of hours. However, that can lead to a disjointed and difficult journey for people at the point that they're in crisis because the service is fragmented. So in order to address the pressures on the service and make sure that we're providing a really effective and consistent response to the local population, as well as supporting the well-being of our staff, who, because of the demand, quite often our county-wide AMP team don't necessarily work office hours. They're often out until very late in the evening because once you've started a mental health assessment, you can't walk away from it and hand it over to someone else. So, you know, they do find themselves out at, 11 o'clock at night, still having worked all day. And, you know, the impact on their own mental health and well-being is quite considerable. So in order to address those issues, we're seeking committee approval to increase the staffing within the team, but also explore quite a different model of service delivery. The county-wide AMP service have, thought this through for some time. We've tried different approaches to try and ease the pressure on the team and the wider service, and they've suggested that the development of a dedicated 24-hour AMP service, one single service, would alleviate the issues and would mean that triage, assessment and ongoing case management would all sit in a single team. This is in line with some of the best practice models that are being developed elsewhere across the country. And, the team do feel that that would give the best possible service to the people who need it most. Adopting this model would require an increase to establishment of 2.8 full-time equivalent approved mental health practitioners. And that's at a cost of £272,000, just over. The detail of the financial impact is set out paragraphs 25 to 29. We have submitted a pressure bid to reflect this. But if that wasn't to be successful, we would need to look at, how we set the budgets for adult social care next year in order to absorb that. So we would be looking to implement the new 24-hour model in agreement with staff. So it wouldn't be a case of compulsory changes to how people work. But the discussions with the staff team to date, staff are really keen to explore this and try this out. As I say, at the moment, they're not working their contracted hours by any stretch. What this would mean is that, if they are working outside of office hours, at least there would be, proper recompense for doing so. We would be paying the out of hours enhancement and the on-call payments, which at the moment they don't get. What they get is time off in lieu, which they then struggle to take back because the service is so busy. So, it would recognise and compensate them for the work that they're doing. And, we would be looking to do that through agreement with staff. I'm going to leave it there, but I'm happy to take any questions on any part of the report.
Thank you, Ainsley. I've got two councillors, Councillor Wise and Councillor Martin. Councillor Wise, Muriel, and Councillor Bosniak at a third. So Councillor Wise, Muriel, please.
Thank you, Chair. Thank you, Ainsley, for the report. I mean, I know the work of these workers well, and I mean, they are outstanding, and the complex situations they take on that absorb hours and hours of time, and it doesn't. the issues don't close at 5 or 5:30, do they? They stay on, and so I mean it's a very impressive area of our work, and I'm sure this is an appropriate recommendation to make. The only thing that I'm a bit concerned about is in paragraph 18, the proposal to be co-located with the Mid-Knots crisis team. I understand that this is perhaps being piloted already, but my experience of the Knots healthcare crisis team in the past has been really disappointing. Difficult to access, people struggling with the recommendations they're making. Some of it is or has been the issues of lack of capacity of bed space and so on. But my concern would be I wouldn't want to see the resources we put in a way, I'm just being kind of straightforward about this, being dragged down, as it were, by the lack of resources put in by the Health Trust. Thank you.
Thank you, Muriel. Ainsley, please.
So the county-wide AMP team are currently piloting the co-location with the crisis team, and the reason that we entered into that is for all of the reasons that you've just said in terms of, you know, difficulty accessing the crisis team, etc. Now, the feedback that I've had from the AMP team manager is that is going really well. It's made a huge difference in their working relationship, that they're actually in the same office, they can have conversations, they can get past some of those issues that, you know, sometimes email correspondence doesn't quite flush out in the same way. And I think actually we've seen some real benefits from working directly with them. So absolutely take on board your comments, and I think, you know, there will always be capacity issues for any part of our service, I'm sure, but they do have quite different roles as well, and the team managers for the AMP team are very clear and quite strong about what their role is within the mental health system, if you like. So I don't see that as a detriment. I think actually working together in the same location has been a positive step and something that we can build on.
Oh, good.
Thank you. Muriel.
That's encouraging. Presumably, if there was a funding issue from the Health Trust, it would coming up, it would be flagged up with you, wouldn't it, or with the managers, so that it is a kind of a strong partnership.
Yeah, we also have other forums in place. We've got a quite wide-ranging management forum in place with the Mental Health Trust, where we do have those types of discussions, and you know, we do discuss our respective pressures and challenges and look for a way to work together to resolve those.
Okay, thank you. That's reassuring. Thank you.
Thank you, Ainsley. Councillor Martin, David, please.
Thank you, Chair. Yeah, I fully support extra investment in staffing dealing with mental health issues. I always will. A COVID-19 study of 90,000 UK adults has monitored mental health symptoms throughout lockdown, finding levels of anxiety and depression fell in early June as the lockdown measures began to lift. But these remained highest among young people, those with lower household income, people with a diagnosed mental health illness, people living with children, and people living within urban areas. I worry that the impact of the new lockdown measures across Nottinghamshire what it will have. This is a sensible investment in staff, especially when you consider that in August a group of NHS leaders said that they were seeing a rise in people reporting severe mental health difficulties with charities, including Mind, Samaritans, Calm. They've all said an increase in people coming to them. They've seen an increase in people coming to them for help. So I fully support the establishment of these posts. Plus, you know, will these absorb the extra pressure that's been put on, or are we likely to see further staffing requirements as a result of COVID?
Thank you, David. Ainsley, please.
Well, I think just to for a bit of clarity, the AMP service is only one part of our wider mental health service. We do have, you know, a much bigger mental health provision within adult social care. This is just one very specific component of that. So the people that the AMP service would see wouldn't necessarily be, you know, that wider population group who have developed, you know, symptoms of anxiety or depression as a result of COVID. The AMP team see the people who are in real acute mental health crisis, who are at risk of, you know, being sectioned under the Mental Health Act. However, you know, you quite rightly say demand on mental health services has grown during the COVID period. And at the moment we are managing that. But that's not to say that, you know, if things go on for an extended period of time, that, you know, we may need to look at how we deploy our staffing capacity to cope with that ongoing demand. But certainly in relation to this specific component of the AMP service, the 2.8 FTE, this is what they've come up with as being sufficient at this point in time to meet the demands that they're seeing.
Yeah, Councillor Martin, please.
Yeah, has COVID impacted on your staffing levels during the crisis?
Yeah, absolutely. We, you know, the same as any other employer, we have staff who have had to shield. We have had staff who have contracted COVID themselves and been absent from work. And that's an ongoing situation across the department, not just within the AMP service. That, you know, we're having to juggle, you know, in the same way as any other employer is having to do. But yes, it has had an impact.
Well, thanks for doing such a wonderful job in a difficult time.
Thank you for those comments, David. Councillor Bosniak, Joyce, please.
Yes, just very quickly, like Muriel, when I first saw this, I thought, hang on, is this the Notts Health Trust trying to use some of our money to prop up their services? So I was reassured to hear what you had to say, and the fact that it would almost be, you'd be keeping an eye on it for quite a while. And I quite like the idea of the forum coming together to talk about up and coming difficulties, particularly around funding, etc. So I am reassured by that, Ainsley. And I'm really pleased to see this, because I'm aware that a lot of health workers in the mental health area feel stretched, and therefore they feel as though they're not doing their job satisfactorily. And that means their mental state isn't that as good as it could be either. So not only does it benefit the individual with a mental health problem, but I think it better protects our staff as well. So I'm delighted to see this. I think it's money well spent. Now, did you say that you put a bid in for this money, and that if you were unsuccessful, you'd have to look for the money elsewhere? How likely is it that you'll be unsuccessful with the bid for this extra money that you're asking for?
Ainsley, the golden question.
Yes.
Well, in some ways, I guess that'll be dependent on you. So I've submitted a pressure bid, as we do every year for areas where we're experiencing particular demands. So that's gone into the process. If for any reason, you know, members felt that you know, this wasn't a legitimate area to prioritise for expenditure, then within the department we would need to relook at how we've you know, divided our budget up in order to meet this. So, you know, we shall wait and see. However, you know, I know that Melanie is very committed to, you know, funding these posts and making sure that the AMP service is properly resourced. So, you know, if we do have to look at it within the department, then we will do so. Just going back to your point about, you know, sort of staff well-being, Joyce, in addition to looking at how we you know, potentially change, you know, the model and, you know, people adopting a shift pattern, what we've also built into that is sufficient time for things like counselling. We're looking at a trauma support service, because quite often, you know, once a member of staff has been out to a really difficult situation, you know, there is the impact on their own mental health. So we have made sure that we have built into the staff rota time for that de-escalation, debrief, and regular sort of trauma and counselling sessions to keep staff well.
Thank you.
Thank you. And as Ainsley rightly mentioned, the first hurdle is ourselves, so we'll take this to the vote. So anyone against? Any abstentions? Therefore, assent will be assumed. Thank you. That is carried. Thank you for your input on this one. Thank you, Ainsley. We'll now move on to item 8 on the agenda, which is the work programme, and I'll hand over to the clerk. Keith, please.
Thank you, Chair. So we have the work programme as members have received within the agenda pack. I think the only thing I've picked up from today's discussions was just in relation to the draft day opportunity strategy, which will be scheduled to come back to committee in March 2021. So unless members have any other issues that the field should be within the work programme, I'll hand it back to the Chair. Thank you.
Thank you. So we'll now move to the vote on this one. Anyone against the work programme? Any abstentions? Therefore, assent will be assumed and the motion is carried. Thank you. That now concludes the business of the day. Thank you very much, everyone, for your attendance. Thank you for all your input, professional experience and useful items that we've now took on board. So thank you very much for all of that. And may I also take this opportunity to thank any viewers on YouTube for their interest in the meeting, and we wish you all well. Thank you very much. Thank you.
Thanks very much.